Today we will explore the connection between addiction and mental health. While this is a topic that often covers a wide variety of issues and information, we will be focusing on introductory information and a preliminary overview to this area. When exploring this topic, the most common concept that emerges is referred to as co-occurring disorders. The basic definition of a co-occurring disorder is someone who is diagnosed with both a substance use disorder and a mental health condition such as depression. In the past, the term dual diagnosis or dual disorders was commonly used, but currently the term co-occurring disorders is preferred. This is because dual implied only two, and in the case of co-occurring disorders, more than two issues can be common. For example, a person with an alcohol use disorder can be diagnosed with both a depressive and anxiety disorder. With co-occurring disorders, some of the most common types of mental health issues that emerge are depressive disorders, bipolar disorder, schizophrenia, obsessive-compulsive disorder, anxiety disorders, and post-traumatic stress disorder. While other mental health issues can be present, these are the types most commonly discussed. In addition to common types, it is important to note that there can be a wide variance in how both disorders impact the person. Some people may experience mild forms of both, while others may have a mild form of one and a more severe form of the other. Still others may have a severe form of both. These differences are important to consider as they can result in further variation in terms of how someone's quality of life and functioning are impacted by the conditions. When discussing co-occurring disorders, a common question emerges: what is the cause? For decades, an attempt to understand what causes co-occurring disorders has been studied. Often people wonder questions such as, does one come first and the other one later? Do they emerge at the same time? Is it a condition that is inherited? While these are understandable questions, the reality is that the cause or causes of co-occurring disorders is a very complex process. The causes most frequently explored have been biological, meaning there is a potential impairment in one's chemical makeup or disruption in optimal brain functioning, and that increases the chances of co-occurring disorders to occur. Another cause is genetic, meaning is this a condition that is inherited from one's family history based on genes? Is there a type of predisposition to co-occurring disorders? Still another is environment. Do environmental influences such as where and how one grew up, the overall family culture, norms, and expectations, do they make one more vulnerable to developing co-occurring disorders? Can one's environment also be an influence? The most common perspective with these potential causes is that each of them, not one, play a role in the potential development of co-occurring disorders. Most in the treatment community do not view it as a single factor or cause, but a combination. To further complicate this area, more and more information and subfactors continue to surface. For example, what role does trauma play in increasing one's vulnerability to biological, genetic, and environmental causes? Or factors such as ongoing life stressors and poverty, how do they contribute to the development of co-occurring disorders? Because of these related issues and questions, it is very important not to distort the role of one cause over another and paint an inaccurate picture. There are still many questions and areas to explore in understanding the causes of co-occurring disorders, as well as answers lacking complete certainty. For example, when discussing genetic factors, too often this gets oversimplified into trying to identify quote-unquote one gene that is the cause, when in reality, assessing genetic factors is an in-depth process that involves looking at multiple genes along with genetic patterns and linking. It is important not to reduce a very complex question of cause into an oversimplified answer. So in looking at co-occurring disorders in this field, it is necessary to proceed with caution when discussing causes. Another area to discuss in the introduction to co-occurring disorders is treatment. In reality, whatever the actual cause, it is still critical to provide those dealing with co-occurring disorders supportive and effective treatment, and this is possible to do. Treatment is very important when addressing co-occurring disorders because, without it, one or more of the disorders can get worse over time, leading to further decline in overall well-being and quality of life. When looking at treatment, in the past, co-occurring disorders were often treated separately or with different treatment providers, meaning clients had discussed one issue with one provider and the other with another, often at another treatment agency altogether. Still, many believe that you had to quote-unquote cure one before moving to another. These treatment approaches have been replaced with a newer model called integrated treatment. This is an approach that treats the substance use disorders and mental health issues at the same time with the same provider or treatment team. It also takes a holistic approach focusing on including factors such as culture, individual support needs, and use of outreach or community services. This allows for a more comprehensive and culturally relevant approach to co-occurring disorders, which has shown a higher success rate. When talking about co-occurring disorders, it is critical to hear from clients about their own experiences. Unfortunately, those dealing with co-occurring disorders often deal with increased stigma and recount their challenges accessing treatment and going through treatment when the approach was focused on separating the conditions. Clients with co-occurring disorders also often share the wide range of life stressors and difficult hurdles they experience. In addition, the topic of youth and co-occurring disorders does not receive the attention that it should. Specialized attention on the youth population is vital because co-occurring disorders often begin to surface during this age, and early intervention can be very effective. In addition, youth with co-occurring disorders often have increased struggles due to the brain still developing, having less understanding of what a co-occurring disorder is, as well as less access to healthy coping skills. Likewise, dealing with peer pressure and stigma during adolescence can be especially challenging and isolating. However, there is also hope as advances are made in treatment, and effective support options and anti-stigma campaigns become more prevalent. In the videos below, you will have a chance to hear the personal experiences, focusing on both the very real challenges and also the hope of those managing co-occurring disorders.